Hi everyone, thank you so much for coming. I am very, very excited about this workshop. My name is Elizabeth. I am an occupational therapist with a passion for working with people with neurological conditions and specifically with ataxia. So I just feel so honored to be called and to be here with you. So today is a full hour, and if possible, we are gonna be moving if you wanna participate. So if you're participating, you might need some space beside you so you don't hit the person next to you unless you want to, just to give you a little extra space. The format for today is we're gonna go back and forth between exercise and education. For the exercise portion, there's 3 types of exercise. We're gonna do some tai chi, some coordination training, kind of proximal stabilization, and then we're gonna be doing what's called sensory boxing. We're gonna go through all 3 of those. Then when we go to the education portion, it's gonna be a lot of research, but in the form of stories. And that's kind of my style, especially with my fellow clinicians, is we get so lost in the numbers. 42 people participated in this study with these assessments. We lose sight of what we're actually here for, and that's the individuals with ataxia. So I do like to give names to research participants. They are not real names, but they are real stories, and that's the research portion. And then finally is the application portion. My very first support group I attended, I thought I was there for support. I thought I would just kind of sit in the background and listen and cheer people and learn. And then she went around, this amazing support group member. We all introduced ourselves, and then she said, okay, we're short on time, so we're just gonna turn all our attention for Elizabeth Foss and her presentation. And oh my gosh, I didn't know I was supposed to have a presentation. So I kind of took my spaghetti brain and put together a bunch of research for everyone. And then at the very end, this woman asked me, she goes, Elizabeth, this was really helpful. So what can I do? Like, what are the exercises? And I didn't have any ready for her, and I felt so empty-handed. So today I am not empty-handed. I have taken a lot of the exercises from the actual research studies and put them together in videos. And most of those videos are on my YouTube channel called Little Steps, Big Gains. And this isn't about me, it's about having resources for you. So I will kind of explain that as we go. And that's kind of the itinerary or the format here. So when we think of core, a lot of people think of crunches. Let's get on there, let's get those abdominal muscles firing. However, how are crunches going to help you drive? How are they gonna help you reach up for that cup? What we really need is a lot of proximal stabilization and a lot of posture and back. We need that they call that your posterior chain. So when we jump into a lot of these exercises, that's what we're gonna be doing. A lot of stabilization. We're not gonna be doing any crunches today. So we'll be kind of going through that. If any of the movements are causing you pain, please don't do that. Please modify them. When we do some sensory boxing, it's optional to include head turns. And that is because the cerebellum plays a huge role in coordinating all of our sensory systems, where we are in space. Our visual system, our somatosensory system in our limbs, and the vestibular system in our ear. That cerebellum coordinates all 3 of those. And that's why it can be really difficult to turn your head or change your position or closing your eyes even, because now you've taken away all the visual input and your brain doesn't really know where it's at. So when we include things like head turns, if it causes you dizziness, please avoid the head turns, okay? So we're gonna start off with our exercises, and the first one is tai chi. The purpose of tai chi is to go really slow, deep breathing, and posture. And the idea is to go slow, because as we move, it'd be really easy for me to reach across my body and just grab a drink. That was so simple and easy. But as I move slowly, my body has to constantly recalibrate. What is the degree that my core needs to move backwards while my hand moves forwards to keep me centered? What is the exact calibrations there, that counterbalancing? And so that's why we go so slow when we reach, and we sustain that position as we come back together. It is easier to go fast, it is harder to go slow, and it takes a lot of patience to go slow. So Our first exercise is tai-chi. We're gonna do 3 moves together. We'll do 4 of each of them. So the first one is a good morning stretch, and I love good morning stretches. I'll demonstrate first. Our hands will be together. If you would like to sit back, feel free. If you'd like to sit forwards, but put your safety first. Together, it's wonderful. We will breathe in, try to go through the nose, and we're gonna breathe out, around, and squeeze those shoulder blades back. And you're like, Elizabeth, this is kind of simple, but if you really sit forward and tighten those abdominals, it's so good for our posture and our balance. All right, so we're gonna do 4 of those when the music starts. Let's do 1 of them together. We're gonna breathe in, breathe out. Squeeze those shoulder blades. Good, and tightening those abdominals. Very good. Okay, everybody looks really good. All right, our next one is gonna be called Draw the Sword. And it's gonna be one hand in your opposite pockets. And we're gonna be breathing in, and we're gonna open up that chest. And it goes breathing in, and you're opening up your chest, and it should feel so good. And then we're gonna breathe out and close everything back up. All right, we'll do 4 on one side and then 4 on the other side. So we'll practice the other side. We're gonna breathe in and open up your chest. Oh, this is so fantastic. And then we're gonna breathe out. Okay, there's a lot of new upcoming research on breath support and speech, which my little sister, Allison Hilger, is doing a fantastic research study on the Colorado Speech and Motor Lab out the corner there. And then that will be our second move, and I'm gonna do this with you. We're gonna be in this together. Our third move is a cross-body push-pull. So we'll breathe in, and as you breathe out, take one hand and turn and reach as far as you can without falling over, please. And then we're gonna be breathing in, and we're gonna switch. You're gonna rotate, and you're gonna breathe out as you reach safely, and then we'll be breathing in, okay? That's a crossbody. It's gonna be slow, so we'll do it together. We'll do 4 of each of them, okay? All right, let's go ahead. Do you mind if we start the first song? We'll do our good morning stretch. Ready? Good, keep those abdominals firing. Breathing in. Very, very, very good. Draw the sword with one hand. Ready? Breathe in. Out. In. Out. Opening up your chest. Very good. One more, okay? Breathing in. And out. Very good. We're gonna switch sides. Keep those core muscles, that posture. Opening up. Breathing out. Two more. Fantastic with your breath. One more. Beautiful. And out. Very, Very good. Our cross body, hand up. Breathe in first. Breathe out, reach across your body. Breathe in. Ready, rotate, reach. Very, very good. Breathe in. Rotate, reach. Breathe in. Rotate, reach. Breathe in. Rotate, reach. Breathe in. Rotate, reach. Very good. Fantastic job. There's also a lot of research on deep breathing and calming our nervous system. I'm sure you've experienced it when you've become anxious about something or there's been something difficult in life and how that affects you physically. There's such a correlation there. So Tai Chi can be really great for just calming our nervous system as well. Okay, now we're gonna do a little bit of coordination, and I'll tell you a super, super quick story. My husband really encouraged me to do something creative and very difficult for me, non-productive. And so he signed me up for dance class, and I did terrible. I did absolutely awful. And I'm in the back, there's one spot and I'm on the back left and I'm completely deaf in my right ear. I couldn't hear anything. And towards the last 45 minutes, I was kind of getting the hang of things. I would give myself like a C-. And then she, instead of stopping the song, she continued it and said, "Everybody, freestyle." And I thought, what does freestyle mean? And so I really struggled and I went home and I told my husband, I said, I failed. I did so terrible. And he said, Elizabeth, this isn't about performance. This isn't about outcome. This is about you are trying to reconnect with your body. And that's what this is about. And so as we start coordination together, if you're punching instead of kicking or pulling instead of, pushing, it's okay. Just try to smile and just try to give yourself a little grace, saying, I'm reconnecting with my body right now, okay? All right, so our next is a little bit of core and coordination. I have a challenge called sitting balance with a broom. We have a broom, we don't have brooms here, but our hands are gonna be out, and we're gonna really tighten our core muscles. When we take one elbow, and we're gonna bend that elbow, and we're gonna squeeze it down as you try to either tap the back of your chair or bring that scapula back and down. Tighten those abdominals. And then we're gonna be bringing it forward. So we're gonna take the other side, squeeze that shoulder blade, and forwards. And there are 3 levels. You can sit back and do this, which is fantastic. You can lean forwards and do this, which is fantastic. Or you can lean forward and tip back, and that's fantastic, wherever anybody is. Find that right challenge, but be safe. That's the arms. The legs, it seems simple, but we're gonna be tightening our core muscles as we extend one leg and very slowly lower it. That's the key. We are not just turning off our muscles, slowly lowering. If you really want to add core, this is difficult. Try to keep your hands behind your head. Keep those scapulas back as you extend that leg and slowly, slowly lower. If you do this correctly, you will find a great core workout. So the challenge is we're just going to do the arms for 5 of them. We're just going to do the legs for 5 of them. And then we're gonna try to combine it. As you pull your right arm back, you extend your left leg. Very difficult. We're trying to do the cross. So if you bring your right leg back, it's your right arm back, it's your left leg forward, it's opposite. And then we come forwards. And then it's the opposite again. Oh my goodness. If you do this, you really feel that those abdominals firing, and your back extensors are kicking in so you're not collapsing. All right, so we're gonna do, yes, it is 5 arms, 5 legs, and then we're gonna try our best to combine them for 7. I'll do this with you. Okay, here we go. Okay, arm. And forwards. Good, really work on that posture, those abdominals. Good. Looking great. Squeeze those scapulas back. Okay, arms up if you want. Let's get those legs going. Ready? Right leg, oof, left leg. Try not to collapse. In other words, don't come down. Try to stay upright. Yes. Oof. Fantastic. Keep those abdominals. No collapsing. Not easy. Everyone looks so good. All right, let's try to combine it. Hands out. Pull one arm back. Oh, extend the opposite leg. Oof. Keep those abdominals firing. Awesome job. Awesome. We'll do one more on each side, so it is that 5. Oh, fantastic job. Okay, next we're gonna jump into what's called sensory boxing. And what sensory boxing is, like I mentioned, we have 3 sensory systems that tell our brain where we are in space. Sensory boxing, we're gonna do boxing moves very slow and incorporate some of those sensory systems if you feel safe doing it. There are 3 moves, okay? So our hands are up. We're gonna look so awesome. We're going to try to turn our head, if you want, over one side about 45 degrees, and then you're gonna punch across your body. And then you're gonna come back, and it's gonna be slow so we don't get so dizzy. You're gonna look over your other shoulder, and you're gonna punch over there. All right, and then we're gonna look straight, and we're gonna march or kick. So we're gonna take one leg up. Yes, and we're marching, we're the other leg up. And then the duck, duck. Someone's coming at you, you gotta duck to one side. Don't fall out of your chair, please. Try to keep those hands still, and yet duck to the other side. Not easy, all right? We're gonna go very slow together, and then I'll say, try to speed it up at your own speed, and then we'll go slow again. So it'll be 4 slow, 4 fast, 4 slow. Once again, if you get dizzy turning your head, go ahead and keep your head still. All right, we're ready for the next one. Awesome. All right, we're gonna go, so look and punch. Come back, or like slow motion in a movie. Punch. Ready, march. Or kick. But it's not really a kick, it's a knee. Ready, duck. Woo. Duck. All right, cross, look, punch. Look, punch. Ready, that knee, knee. Ready to duck, duck. Ooh, get those abdominals. Duck. All right, look, punch. We're like slow-mo action movie style. Punch. Ready for that knee? Oh, knee. Yes. Ready for the duck? Duck. Duck. All right, ready? Look and punch. Look, punch. Ooh. Ready for that knee? Knee. Knee. Ready for the duck? Duck. And duck. Okay, at your own speed, all right? But for the speed part, keep your head forward. Punch, punch, knee, knee, duck, duck, okay? Ready? Go. Everyone's doing their own thing, okay? Duck. It's a punch, knee, duck. It's not easy, okay? It's okay to remember my dancing. It was terrible, okay? Just smile, we're just trying our best. One more, okay? All right, that was really difficult. Back to slow, okay? Punch, punch, knee, knee, ready, duck, abdominals, abdominals. All right, look, punch, look, punch. Ready for the knee, knee, and then our duck, and our duck. Good job. The sensory boxing is a little bit easier than the crazy coordination, but they're both good in their own way. Okay, so that was our first portion of exercise. Now let's jump into a little bit of education. And the first question we're gonna go over is exercise even effective? You know, is this all just false promises to you? So I'm gonna break down the first section here on, because ataxia can sometimes be bifurcated into if it's acquired from something like a stroke or a traumatic brain injury, or inherited and genetic. And we're gonna go over both of them because they are different. So the first portion is on acquired ataxias, and the second portion will be on genetically inherited forms. So this one has 3 stories, 3 research studies, but I call them 3 stories. The first one is the story of Mary. Mary's a 51-year-old, very athletic female, and she had a cerebellar infarct. So she had blocked blood flow to her cerebellum that caused massive brain injury to her cerebellum. The doctor went in to remove it, craniotomy, remove that tissue. Afterwards, she got hemorrhages of the brain and then a buildup of fluid, so she had hydrocephalus. And the doctors looked at her and they said she has a very poor prognosis, because prognosis is either good, fair, or poor. And they said poor, we should really look more at palliative care, which is more comfort care. And this is very common a long time ago, where anybody with cerebellar infarcts or damage would just have a poor prognosis. It was just the label. So instead she went through, her deficits were weakness, whole body ataxia. She had double vision, dysphagia, difficulty swallowing, difficulty communication, and a lot of emotional lability, difficulty regulating her emotions. So she went to rehabilitation instead of palliative care. In this case study, 14 months later, 14 months, she walked out with her husband standing next to her. She got dressed with what's called setup, where they would give her her clothes and she could get dressed. She went to the bathroom with what's called supervision, meaning her husband was just by her. Mary has made significant progress towards safety and mobility and was able to return home despite the early discussion about a poor prognosis and a palliative care consultation. Just an amazing case study. That's a case report. So is Mary a unique case? So this is story number 2. Dr. Kelly, now the actual doctors are real doctor names. Dr. Kelly, so he wanted to quantify the recovery after a cerebellar stroke. So he looked at 49 individuals with cerebellar infarction, so most common type of stroke for the brain. And he looked at all of these cases, and after looking at all of them, 80% of the individuals started with moderate impairments and left with minimal to no impairments. 66% of them left completely independent. And that is just incredible. So overall, this data confirms the extended previous reports indicating excellent functional recovery among survivors of cerebellar infarction. One more story. This is the story of William. So William had a traumatic brain injury, a rock climbing accident, and he was recruited by his neurologist for a study, physical therapy for correcting posture and coordination deficits in patients with mild to moderate traumatic brain injury. There was 20 patients total, so we're pretending Brian is one with 19 other individuals, and he was given some inner coordination for the arms, the legs, postural stability, gaits. He did 20 sessions, 60 minutes each, 4 to 5 times a week for 4 weeks. He found improvements in his static and dynamic postural stability, his gait, and reduced truncal, upper, and lower extremity ataxia. And so the application portion, as I've said, well, what did they do in that? And so I have a whole list of the exercises they did, and I have a beautiful young woman named Ellie Martin. She's here at this conference. She has cerebellar ataxia, and I videotaped her doing these exercises, and I do have them. So just fantastic. And the big theme there is something called neuroplasticity, brain damage to an area of the brain, and how our brain can rewire itself and create new networks around those damaged areas. Next, we will go over genetically inherited progressive forms of degenerative ataxia. But first, we have another round of exercise. Okay? So this tai chi routine only has 2 movements because I thought I'd just kind of create some continuity so it's not so much on the brain to do too many moves. So the first one is our good morning stretch again, which you guys know, and it's so good for us. So you squeeze those scapulas back behind you, those shoulder blades. Like I put an ice cube down your back and you go, oof, okay. And then the second one is called roll the ball. And this one incorporates rotation. It's a little bit harder to understand sometimes, but there's a ball in front of you. Your hands are holding it on each side. As you breathe in, you're gonna take one arm, and that's the arm that's going to start the roll, okay? So for me, it's my left hand. And it's gonna start the roll where it's going to kind of vertically, it's gonna take that ball and it's gonna roll it to one side. And I'm gonna turn my body and rotate with it, okay? And then we're gonna be breathing in. Our hands are side to side again. And then the other hand is gonna start the roll. And you're gonna reach across and feel that rotation. Everything's opening up on that side, and then we're gonna come back again. And when you come back, your hands are always side to side on that ball. You're holding it again. All right, so I'll do everything with you. And if it gets a little off and you're doing something off, that's okay. Just remember you have a ball, and you're just trying to roll it. And you're trying to roll it, okay? It's not easy, so just try your best, okay? All right, so we'll do 4 of each, and I'm gonna be with you. All right, we're ready. Breathing in and out. Squeeze those scapulas, tighten those core muscles. Breathing in, breathing out. Very, 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 very good. Breathing in and out. One more. Okay, we're gonna hold our ball now on each side. Breathing in, and then roll that ball. Try to rotate. Breathing out. Breathing in, roll and rotate that torso. Breathing out. This is fantastic for our core muscles. Breathing in. Feel that rotation. Breathing out. Breathing in and rotate. Breathing out. This is very, very good for us. Breathing in. Rotate. Breathing out. Breathing in. Breathing out. I think we have one from each side. Breathing in. Breathing out. Breathing in. Breathing out. Fantastic. I hope you feel that like I do. It's so good for our torso, our core, everything, our posture. Okay, so now we are back to some coordination. Our hands are gonna be up instead of in front of us. They're going up. Hands are a little further apart. We're gonna take one elbow and we're gonna drop that elbow towards your hip. You're gonna take it towards the hip. Now take your top arm and try to punch the ceiling. Oh my gosh, do you feel that? Oh my goodness, and then we're gonna switch. We're gonna drop one arm and punch the other arm. Very good. Oh, and then come back up. So we'll drop and punch, and then we'll drop and punch. Fantastic, okay? Our next one is for the legs, is going to be that march again. And once again, you can make this more difficult if you want by keeping the top of your body upright and not collapsing. But we're just gonna take one knee and we're gonna bring that up. And then we're gonna bring it down. And this is not easy if you really tighten your abdominals. So if I were to put all these electrodes all over you to see what muscles are firing first, we actually want your abdominals to fire first and then your legs second, okay? So abdominals, legs, abdominals to stabilize. We have to stabilize first. It's stability before mobility. And I think sometimes the timing of that can be off with ataxia because it's not just the coordination of the muscles, it's the timing of them. We really need to stabilize first, okay? Not easy. Then we'll try to combine it, which is so difficult. But as you drop your right arm, try to march your left leg. Ooh, it's so difficult and so good for us. And then the other side, feel those abdominals, okay? We'll try our best. If you wanna break it down and just do the arms, then just do the legs, that's fantastic, absolutely amazing. I wish my dance class had that option. Do what works for you, okay? All right, so we'll do 5 arms, 5 legs, and then we'll go into at the same time. All right, I think we're ready for our music. Whew. And I love this song. All right, we're gonna take one elbow, drop it, and reach the other arm up. Whew. All right, pull and punch. Oh my goodness, this is so good. Pull and punch. Ooh, such a fantastic core exercise. Pull and punch. Good, stabilizing those core muscles. I feel it. Awesome job. Pull and punch that top arm up. Oof. All right, if you want the arms, you can, but we're gonna really tighten those core muscles and then bring that knee up after. Core, knee. It's really hard not to collapse. What I mean by that, it's hard not to do that. Very good. Just try your best, okay? Whew. From here, everybody looks amazing, so. Awesome job. Core muscles, they're probably getting tired. They're getting tired, you're working them. Oh my goodness. All right, let's try. Bring one elbow down and lift the opposite knee up. Oof. Oh my goodness. So fantastic for us. It's a lot to coordinate though. Take that top arm and punch it if you can. So it's a pull, punch, and march. Oof. A little difficult to say the least. Oh my gosh. Oh. Let's get that other leg in. Oh my goodness. Oh, fantastic. I really do mean that. Okay, so now we have our boxing again. Don't worry, just one more round of exercise and then I go back to talking. Okay, because it's a lot. So this is a little difficult, but I think we can do it. It's gonna be a hook, hook, uppercut, uppercut, and a duck, duck. So when we hook, we're gonna look over our shoulder and we're gonna take that arm and we're gonna try to bring our elbow up like a chicken, okay? And we're gonna bring that arm around, we're gonna hook, take that elbow across. And then we're gonna lift the other one up and we're gonna hook. All right, whoops, sorry about that. And then we're gonna do an uppercut. And I know this is kind of extreme movement, but we're gonna take that arm and we're gonna uppercut. And we're gonna uppercut. And then our duck is gonna actually be forwards, backwards. So we're gonna go forwards, try to keep your arms up though. Good. And then backwards and try to keep your hands forwards. All right, we'll practice again. Look over your shoulder, lift up that elbow, bring it across for that hook. Okay, this is kind of unusual boxing, but elbow up. We're gonna hook. And then we're gonna bring one arm back, around, uppercut. And then back, around, uppercut. And then forwards, backwards. All right, we'll do it slow together because going slow is really fantastic. We're challenging our core muscles the whole time. And then we'll try fast and then go slow again. All right, here we go. We're ready. All right, look over your shoulder. Lift up that elbow, come across, hook. And then the other arm up, all the way across, all the way across. One arm, bring it back, up, back, up. Tighten your core muscles. Forwards, backwards. All right, let's do it again. Tighten those core muscles. Ready? Bring that elbow up, 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 around. The other arm, elbow up, around. Tighten those core muscles. Bring your one arm all the way back now and up. The other arm, I know this is hard, and up. Okay, now forwards, backwards. Awesome. Let's do it again. Look over your shoulder, elbow up, hook. Tighten your abdominals. Ready? Hook. Ready? Uppercut. Tighten those abdominals. Get that core going. Forwards, backwards. Oh, so good. One more. Ready? Look over your shoulder. Anyone back there? Look forwards. Hook. Look over your shoulder. Anyone back there? Hook. Uppercut. Uppercut. Ready? Forwards. Now hold those arms while you go backwards. Okay, try fast. So it goes hook, hook, uppercut, uppercut, forwards, backwards, at your own pace. Everyone looks like, keep going, we got this. Awesome. Oh wait, my gosh, I messed up. Just want to give you a little encouragement. All right. Fantastic. Not easy. Okay, now let's go back to some education. Research in the form of stories. So 3 stories again. This one's about Sammy and John. They were recruited into a study called Cerebellar Ataxia Rehabilitation Trial in Degenerative Cerebellar Disease. The question was, can intensive rehabilitation help individuals with degenerative cerebellar disease? If so, can sustains even be gained? Do we make improvements, and then as soon as we stop, do we lose those improvements? Those are the 2 main questions of this study. So Sammy and John joined 40 other individuals. Sammy was in the first group, John was in the second group, and they did the same exercises. And I do have to say they were really intense because they did 2 hours of inpatient PT and OT during the week and an hour on the weekends. I know it's kind of intense, but they found, despite having degenerative cerebellar disease, they showed significant functional gains in their ataxia, gait speed, and their ADLs, that's their activities of daily living. Improvements of their truncal ataxia was more prominent than their limb ataxia. And then the big question is, well, can these gains be sustained? Well, the gains of their ataxia and gait were sustained 12 weeks and 24 weeks later. So they found, based on this study of these individuals who did these exercises, short-term benefits of intensive rehabilitation was evident in patients with degenerative cerebellar disease. Although functional status does tend to decline after 24 weeks, which to me is a really long time, because who doesn't decline after they stop exercising, gains were maintained in more than half of the participants after that. Dr. McQuare, that's actually the doctor's real name, but so he did a systematic review. In other words, he took a ton of articles. 19 doesn't sound like a lot, but it is actually a lot when you're going through all of the participants, all of the assessments they did. And this was for cerebellar ataxia. 5 of these studies were for individuals with multiple sclerosis. 4 were degenerative ataxias, 2 were strokes, and 8 were just various etiologies. And he said, if we look at all of these together for cerebellar ataxia, can exercise or rehabilitation help? There is moderate evidence, which is actually very good here, that rehabilitation is efficient to improve postural capacities of patients with cerebellar ataxia. I love this part, particularly in patients with degenerative ataxias or multiple sclerosis. He highlighted those. Awesome. Intensive rehabilitation programs with balance and coordination are necessary. Last, this is one of my favorite stories. It is a research article, obviously. Dr. Ilg, and so what he wanted to find out is there was more and more research initially on the cerebellum has 3 anatomical subdivisions and 3 functional subdivisions if you subdivide it. And yes, if there's damage to one part, well, of course recovery is going to be effective because that was only damage to one part of the cerebellum, easier to kind of reroute around that damaged area. So he said, well, let's recruit people that have focal, global degeneration of the entire cerebellum. Can exercise be effective for these individuals? So I won't tell you the name of the study till the end, but he recruited 16 individuals. And Dr. Doris Britz was the physiotherapist. And these individuals had progressive ataxia due to cerebellar degeneration. We're going to say Brian was in the first group who had progressive cerebellar degeneration. Nancy was in the second group, and these individuals had degenerative also afferent pathways, so sensory pathways were included. So think of maybe Friedreich's ataxia that has a sensory component as well. So they did 4 weeks of intensive training, and they found significant improvements in a reduction of their ataxia symptoms observed in their clinical scores. In patients with cerebellar ataxia, coordinative training improves motor performance. It reduces ataxia symptoms, enabling them to achieve personal, meaningful goals in everyday life. So I want to know what they did, of course. So I contacted Dr. Ilg, and I contacted Doris Britz, the physiotherapist, and we went back and forth with emails, and she was so cool about it. And I wanted to make sure I did the exercises correctly, and narrowed them down, took videos of the exercises they did, and created a 30-day program. And the 30-day program isn't about finishing in 30 days, but it's just boring to do the same exercises over and over and over. So it is the same exercises, but I changed the dosage, so it's a little different. And that's called the 30-day Intensive Coordinative Training Challenge. It is intensive, but you modify. So instead of getting up from a floor, get up from a chair or something like that. Tomorrow, Amy Bastian's going to speak, and these are quotes from her. She said, this work is particularly exciting because it shows that individuals with cerebellar damage can learn to improve their movements. She says this is a new avenue for improving motor skills and functional performance in a population of individuals, and I love, this is, amazing, previously thought to have little chance for motor recovery. And I love that, and these is pure cerebellar degeneration. Okay, exercise is effective for progressive forms as well. All right, one more round of exercise, and then a little bit more application. Okay, so this one is back to tai chi. I like a little continuity, so we have our good morning stretch. So we have our posture, we'll be breathing in and we'll be breathing out. Okay, the next one is, I used to call it stir the pot, but now I call it sweep the honey. Because on one hand, our hands are up. We're gonna be reaching to the side now. We've been doing a cross, and now we're gonna go to the side as far as you can safely. And then we're gonna be going forwards. Keep that arm straight all the way around. And now it's the opposite side of your body. Oof. And then you're gonna pull that in. Okay. Now your other hand, go to the side, directly on the side of you, all the way without falling out, all the way forward. Sweep that honey like there's honey in the air. Reach across your body and come back. Okay, and we'll do that together. We'll do 4 of them. And then the third one is one of my favorites, but it is a little advanced. It's called Dancing with Rainbows. And our hands are gonna be kind of over our head like this. But here we go. Take those elbows and squeeze them back. Feel that in your back? Oh, that's so good for us. We'll be breathing in. And as we breathe out, we're gonna take one hand and we're gonna extend it. And then we're gonna try to reach with it. Now, do you feel when you reach with that outstretched arm, everything firing over here? And if you can, try to keep that elbow back if you can. And then we'll be coming up. Now, extend your other arm. Try to reach, but keep that top elbow back. This is very advanced, but very, very fantastic. You probably feel all the muscles firing. Okay, those are our 3 moves. We'll do 4 of each of them. I'll do them with you, okay? All right, we're ready. I like this song too. All right, we're just gonna start breathing in and out. That looks awesome. Breathing in, out. Good, posture, posture, posture. Great for your posture. One more. All right, sweep that honey. All right, take one hand, reach it to the side of you. Now forwards, keep that arm straight, all the way around. Cross your body, and then back to center. Other hand, straighten it to the side as far as you can, all the way around. Keep that arm straight, back to center. Back to that first arm. Reach, sweep, 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 all the way across your body, back to center. All right, reach, sweep. Oh my gosh. Reach, sweep. Fantastic for our core muscles. One more, reach, sweep, all the way around. I hear some people doing fantastic with their breathing. Okay, hands up, elbows back. Oh my gosh. Extend, reach, keep that top elbow back. Feel that? I do. Breathe in, breathe out, reach, keep that top elbow back. Breathe in, breathe out, reach, extend, and back. Reach, extend. Reach, keep that top elbow back. Reach, extend. Oh my gosh. I think we have time for one more. Reach. Oh, we do. Reach. Oh, we're gonna go to that good morning stretch. Okay, ready? Breathe in and up. Around and down. Ready? Breathe in and up. Around and down. There we go. Oh my gosh. These are really, really, really good for our core muscles. Very good. We're not doing any crunches. Okay, back to our coordination. So, and we're almost done with the exercise part because this is a lot of exercise. Side press and side step. So our hands are gonna go back forwards again. And we're gonna take one arm, and we're gonna keep them straight, and we're gonna bring it all the way to the side. Level 1 is to lean back, which is fantastic. Level 2 is to go further, and level 3 is to rotate and bring that back, and then come back forwards again. And then we're gonna go to the other side. We're gonna rotate or reach back and forwards. Not easy, all right? Remember, we're not collapsing. Then the second part is a side step. So one leg, you're gonna pretend like you're going in and out of a car or bathtub, or I were to put a block right here, and you're gonna lift that leg up, over, around the block. And try not to let your knee collapse in. That's actually really difficult. Recruit those hip muscles. And then up and over. So it's up and out. Try not to collapse. Up and over. We'll be doing the other side, obviously. Up and out. Don't collapse. Up and over. So we'll do the arms, we'll do the legs, and then, you know what's up? Opposites. So one arm goes out while the opposite leg goes out. Tighten those core muscles. Tighten them. You should feel it. And then come back in. And then bring it out the other way. Remember, try not to let your knee collapse. And then come back in. Get those glutes involved there. And then we're gonna go out, and you're gonna open up. This is really actually a big, big, big core workout. And then we're gonna go to the other side, okay? Arms, legs, coordination. This is the last exercise, because it actually is a lot. Okay, all right. If I look at my notes, okay. All right, so we'll do the arms. Out, in. Out, tighten those abdominals, and in. Out, in. Out, in. Out, in. This is not easy. Out, in. One more on those arms. Out, in. Last one, the other side. Out, in. All right, you ready? One leg. Up, over, out. Don't let yourself collapse. Up, over, in. Up, over, out. Up, over, in. Up, over. Don't let that leg collapse. In. Ready? Up, over, out. Keep that leg out. And in. Up, over, out. Up, over, in. Keep those abdominals firing. No collapsing. Good. All right, let's try it. Arms are up. Okay, opposites. Out and in. So the arm that you pull back, the other leg that comes out. I know I'm challenging your coordination. This is not easy. This is not easy. That's why I told you about dance class. Out and in. I didn't time this well. Let's do a few more. Out. So hard. In. One more. Out. In. Okay. And out. And in. A lot of brain and body. That was really, 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 really difficult. Really difficult. Okay, one more. I know I said the last one was the last one. What I meant was like this is the last chunk. Okay, so our sensory boxing. This is a good one. Okay, our hands are gonna be up. We're gonna try to look up on a diagonal because you're gonna take one hand and you're gonna punch it upwards. And then we're gonna come back to center. You're gonna take the other hand, you're gonna punch it upwards. And then we're gonna come back and we're gonna do really important exercise. Our butt muscles. We need those so much for standing up and stabilizing our pelvis. So if you're like this, you need your butt muscles to kick in. So we're gonna squeeze our butt muscles 2 times. So squeeze, squeeze. You're squeezing your butt muscles. Then we're gonna go ahead and cross our arm down and then down. I'm gonna go fast for a minute to show you. It goes up, up, but, down, down. All right, not easy. We'll go real slow together. We're all in this together. And then we'll go fast and then we'll go slow. Okay, I think we're ready. One hand, look up, punch, come back. Look up, punch, come back. Squeeze your butt muscles, squeeze, squeeze, cross down, down, down. Oh, this is a really good core workout. Up and across, up and across. Get those butt muscles firing. Butt, down and across, down and across. All right, up and across. Keep those abdominals firing. Butt muscles, down, down and across, down and across. Whew. Ready? Up and across, up and across. Butt muscles, down and across. Oof. Oof. All right, try to go fast. Up, up, butt, down, down. I'm gonna be quiet, try your best. All right, back to slow, back to slow. Ready? Up and across. Up and across. Butt muscles, down and across. Down and across, keep those abdominals firing. Fantastic. All right, one more round of education because you guys are amazing. Okay, so as we learned a lot here, the core is not about crunches, but we're also thinking posture. Once again, we need stability for mobility. So I'm gonna tell you, I think I'll only have time for one more story. This is a pretty cool one. This is actually, Dr. Amy Bastian is speaking tomorrow. She's a researcher who does this, and Dr. Jennifer Keller. So they did a home balance exercise program, and I love that it's at home. This wasn't inpatient. This wasn't with therapists there. These were at home, and they were unsupervised exercises that the participants either did sitting, standing, and or stepping. There was no walking involved in this. They had 14 individuals. We're gonna say Sandra's one of them. And she did all these exercises, sitting, standing, stepping. Sandra didn't walk at all. Yet, at the beginning, before the exercise routine, I didn't write down how long it was, and then after, her walking improved. And they didn't do any walking. And a big key component of this is the benefits of stability, proximally, working on those things and how it can apply to walking. I have so many patients that say, I want to work on my walking. Yes, we'll work on it, but these are some things that you can do outside of seeing me. I'll walk with you when I'm with you, but then when you're at home, do some of these things unsupervised. So I also took the exercises that she did in her research study, the whole list of them, and I also put videos to those. Another 30-day program. Once again, it's not to do in 30 days in a row. That's not the goal. It's just to add a little bit of diversity. So I took the exercises from that research study and I went ahead and I put it together online into a program. The other stories I have to do a lot with posture. One study showed that this female, all she worked on was her scapulas, that's it, and her standing improved. And a lot of that is when our scapulas get weak and we curl over like this, it brings our whole center of gravity forwards. And once again, driving, reaching, standing, stepping, we're kind of falling forward as we walk, just working on our scapulas alone. So a lot of core is posture, stabilizing proximally. If you, this application. If you really enjoy any of these on my YouTube channel, I have tai-chi and sitting, tai-chi and standing. I have something called tai-chi walking. which is really fun. 5 minutes of tai chi walking. You could do that holding on to something. Balance with a broom. That's kind of the core. If you like, oh man, I like this coordination. They're all with a broom. If you like the coordination, I have a household hustle. I use things like mouthwash and peanut butter bottles to show that you can use objects around your house. If you have a band, I have something called a band and balance challenge. So you use the band exercises on even days and tai chi on odd days. So I balanced it out. balance. The static standing balance challenge takes exercises from Amy Bastian's study. The Intensive Coordinative Training Challenge takes exercises from Dr. Ilg. The Stability for Mobility is back to Amy Bastian. And then I put all these together as well, and I have a challenge called Better Balance for Ataxia. And I really had to think about that because I really I had to cut out Parkinson's disease, I had to cut out multiple sclerosis, and I just had to put ataxia in the title because there's enough for those other diagnoses. There's just not enough if you search ataxia exercise. So it's a 30-day Better Balance for Ataxia challenge. And this isn't about me, this is about those resources. I don't want to come empty-handed. If you like the channel, please subscribe to it. The reason for that is if YouTube doesn't see subscribers, it might get buried under bigger channels. I'm a little channel, and so I don't want to be buried. And so that's the reason of subscribe. And I also like to say, I mean, it's all free. This is free. There's nothing there, just free videos, little steps, big gains. Exercises for ataxia. So I hope that you leave here a little encouraged that the research supports exercise, maybe learn a little bit, and now you have free resources. So thank you so much for coming to this workshop.